Rheumatoid arthritis is an autoimmune arthritis. It is the most common inflammatory arthritis, commonly seen in female. Female male ratio is 3:1. Rheumatoid arthritis is a disease of synovium. Due to its erosive property, it destroys the joint. It mainly affects the peripheral joints. Among axial joints, it only involves the cervical spine. Rheumatoid arthritis most commonly affects the metacarpophalangeal joint. Wrist and proximal interphalangeal joints are also involved, but DIP is not involved in rheumatoid arthritis. Now, coming to the pathogenesis of rheumatoid arthritis. First, there is inflammation of the synovium. The synovium is inflamed. Then, there is vascular proliferation in the joint. This results in abnormal tissue growth in the joints, which is called pannus formation. Sometimes the blood vessels are blocked due to deposition of the immune complexes. The blood vessels are blocked due to deposition of the immune complexes, which results in destruction of the synovial membrane, which is the reason for joint manifestation. Now, let's come to the deformities. Number one is Swan neck deformity. In this deformity, there is flexion at the distal interphalangeal joints and extension at proximal interphalangeal joint. Next is boutonniere deformity, also called as buttonhole deformity. In this deformity, there is flexion at proximal interphalangeal joint and extension at distal interphalangeal joint. Next is Z deformity or zigzag deformity. There is radial deviation of the wrist and ulnar deviation of the fingers. In the picture, you can see there is radial deviation of wrist and ulnar deviation of the fingers. This is in fact the earliest change. Next is piano key deformity of the ulnar styloid. This occurs as a result of rupture of extensor carpi ulnaris tendon. As it ruptures, the pressure exerted by this tendon is gone. The end of the ulna becomes unstable and becomes prominent from outside. When the ulnar end is pressed from outside, it is depressed and rebounds when the pressure is released. Next is subluxation of the metacarpophalangeal joints. Next is hitchhiker's thumb deformity. Hitchhiking is a means of transportation that is gained by asking individuals for a ride in their car. The persons are called hitchhikers. When they ask for lift, their thumb is in abduction and hyperextension. This kind of deformity is called hitchhiker's thumb deformity. Now come to the Hogan Jackson syndrome. In this syndrome, all the extensor tendon, that is third, fourth and fifth extensor tendons are ruptured. Only the extensor indicis tendon is intact. Next is intrinsic plus deformity. This occurs due to chronic tightness of the intrinsic muscles. As a result of subluxation of MCP, there is flexion of MCP and extension of the interphalangeal joints. Which results in intrinsic plus deformity. Next is Operaglass hand deformity. There is shortening of fingers due to destruction of the phalanges. That's why excessive skin gets folded, which transversely resembles like an opera glass. Now coming to the lower limb manifestations in rheumatoid arthritis. Metatarsophalangeal joint is the first affected joint. There is a triad of lower limb manifestation which includes pes planus or flat foot, forefoot varus, and ankle valgus. Another manifestation of lower limb is cock-up toe deformity, which is characterized by hallux valgus, and hyperflexed digits.